here's your ACL. ACL looks great. PCL looks good. Let's look at your lateral compartment. Bring it up and across. Wash it out a bit. Lateral meniscus looks sharp. I mean, you really have a good-looking cartilage bumper. The articular surface looks perfect. If we come down into a little bit of flexion, see the meniscus up front. As we come down to full flexion, we'll see the anterior portion. You got a little cartilage tear on the anterior portion. No big deal. We'll clean it up for you, but then we'll go to the medial side. Alright, so you got an ugly looking medial meniscus there. You got big tear back here. Big unsticky, press down, Paul. Got a big unstable tear in the back. We'll wash it out a bit so you can see it better. See this big unstable tear, but look at the arthritic changes on that femoral condyle. You're delaminating all your cartilage on that tib. That femoral condyle is better. Got a little fragmented portion back here. When we start in the back and work our way up, we can actually stick the scope back here to see it a little bit better. Alright, have the Predator. Pretty torn up back here. Alright, let's look over at the other side. Clean up some of the femoral condyle here that's worn down. Tibia plateau is really delaminating. You're getting very, very worn down here. You didn't expect this. For the Predator, up lighter, please. Push down. Push down there. Okay, lower the table a bit. Thanks. That's good. That's good. Shaver. All right, I think your meniscus is not going to be an issue anymore. We've cleaned that up pretty nicely. That cartilage surface certainly will be. Femoral condyle still looks good, except that if you go all the way in the back, you're going to see some wear there. We'll clean up the transition area in a second. Let's look at the rest of your knee. Let's go up by your kneecap, have the blunt scope. Here's your articular cartilage on the kneecap. Looks pretty worn also. We'll look at the trochlea. If we move you down to flexion, you still have a good trochlea, but you've got a divot in your femoral condyle there. We'll come back from this side and actually clean up that meniscus one last time and we're finished. Yeah, you're right. All right, so again, cleaned up the meniscus. Get rid of. We're going to wash you out, and we're pretty much finished.